Gabapentin is like the have you tried yoga of pharmaceuticals for chronic illness and pain. That's my hot take. If you love gabapentin and it works for you, first of all, I'm happy for you. Second of all, you probably don't want to watch this video. You should probably just skip it. I hate gabapentin. I don't just hate it because I've tried really hard with it and it didn't work for me. I don't just hate it because everyone will not stop telling me to try gabapentin, even after many, many years. I don't just hate it because doctors and gynecological societies and pelvic pain societies act like it's a proven, established treatment for pelvic pain when it isn't. That actually is why I hate it. I hate it because it hasn't been proven to be effective for pelvic pain or a lot of chronic pain conditions. But it has been proven to have some very serious side effects, including long-term ones, like a 45% increase or association of developing dementia and cognitive decline. Now, if gabapentin actually worked really well for chronic pelvic pain and pain conditions, and it still had the negative side effects, I would say it's your choice, go for it. My issue is the fact that it doesn't have good evidence. In fact, it has the opposite of that. It's shown to not be effective. It's shown to cause harm. So for starters, there's a lot out there. This is from 2023 about the association of gabapentin and pregabalin, the risk of dementia. It's been covered on CBS. Gabapentinoids linked to a 45% increase in dementia risk, cognitive decline, especially in older adults. And unfortunately, that's true for a lot of medications that help pain and help neuropathic pain. But the difference is, in my opinion, is that gabapentin isn't working for most of us. And if it does work, it's often only working a little tiny bit and it's not working enough. This 2020 study is the most important study for specifically pelvic pain. So it's called GAPP2. And the conclusion is that gabapentin did not result in significantly lower pain scores in women with chronic pelvic pain. And it was associated with higher rates of side effects than placebo. So it did do something, just didn't help. This webpage is a plain English summary of the original research article. Again, stating gabapentin should not be used to treat women with long-term chronic pelvic pain. It does not reduce pain, nor does it improve women's physical and emotional well-being. It states some of the things they found at the end of the trial. The pain scores were similar in both groups, and side effects were worse with gabapentin. As a result of this study, the Royal College of Obstetricians and Gynecologists is not going to recommend gabapentin as a first-line therapy for chronic pelvic pain. We also have a 2022 study about gabapentin and chronic pelvic pain that basically concluded the same thing, that there were some differences at 3 and 6 months, but the two drugs did not differ in the reduction in pain scores from baseline. Here's another one from 2017, just a random study that I found. Gabapentinoids should not be used for chronic low back pain. Here's a 2019 study, gabapentin for the treatment of vulvodynia. Conclusion, as compared with placebo, it did not reduce tampon pain. The data from this study did not support the recommendation of gabapentin as a treatment for vulvodynia. Now, if gabapentin's helped you, if you didn't follow my instructions and you watched this video, even though gabapentin has helped you, you're not crazy. Even in that other study I mentioned, the GP2 whatever, they did say that a small subset of women did experience improvement on gabapentin, and they were also people who experienced in an MRI, they did like a pinprick and it showed that they had pain when other people didn't and that they were responsive to gabapentin, but they concluded that that's impractical for those tests to be done on every patient to decide who might benefit from it, and that wasn't worth the risks. This study here, moderate quality evidence, has an effect on people with neuropathic pain after shingles or due to diabetes. So those are two very specific diagnoses with physical root causes that have been specifically diagnosed, and most of us with pelvic pain don't have the luxury of being told like, oh, your nerve pain is because of a virus or because of diabetes. Like, we don't even get that far. So it's really important, the fact that they were able to narrow down these patients to what their actual root cause of nerve pain was, to then find out that gabapentin could help them. It's really important to me to be able to show you that these results, positive results, was 3 in 10 people had pain reduced by half or more. So not 100%, just somewhat, half or more, is gabapentin, and 2 in 1 with placebo. 3 in 1 was gabapentin and 2 in 1 was placebo. That's not a lot. That's not a high rate of efficacy. And when they only said pain was reduced by a third or more, so not up to 50%, then 5 in 10 and 3 in 10 with placebo. And then for diabetes, it was 4 in 10 versus 2 in 10 with placebo. So some efficacy, but really not that much higher than placebo. And the last sentence of this paragraph, there was no reliable evidence for any other type of neuropathic pain. So ultimately, my problem with gabapentin is simply that doctors are acting like it's going to help everyone, that it is an actual established and proven treatment for pudendal neuralgia or vulvodynia or interstitial cystitis, when that's not the case. That research doesn't exist, and the research that does exist says it doesn't help. I think doctors need to be honest with us that there is a very low possibility that these medications, these gabapentinoids, Lyrica, pregabalin, gabapentin, will be helpful, and that if they are helpful, it will not be a cure. It will be a modest up to 30, up to 50% decrease in symptoms and pain. And they need to be honest that this is not really a treatment. This is a Band-Aid with serious risks, that we don't want to stay on this medication forever because we don't want cognitive decline and sedation. Gabapentin should not be, in my opinion, a solution, a treatment to anyone with pelvic pain. They need to be having their root cause addressed and diagnosed. I mean, case in point, this is the Pelvic Pain Foundation of Australia, and they are giving out a fact sheet on pregabalin and gabapentin. And they are informing people that these medications affect how nerves send pain signals. And they are used to treat pain. And they are used to treat neuropathic pain and less likely to cause sleepiness than amitriptyline. And that's it. That's all they tell you. It's going to work for you. It's going to help you. And here's all the ways you just got to get up to like 1,800, 3,600 milligrams a day, and then you'll be cured. That's not okay. Be honest. Tell us the truth. These medications don't have good research behind them. They are not proven to work for these conditions. They are not proven to be very effective for any chronic pain conditions. Don't do this. I know a lot of people like myself start feeling kind of horrible about ourselves when our doctors are saying, this is all we'll give you, this is all we'll do for you, and they act like this will work, and then it doesn't work at all, and you just end up feeling like, what's wrong with me? I've seen dozens, hundreds of women now in my Facebook groups and on social media being like, I guess I don't have neuropathic pain because gabapentin didn't work. Why didn't it help me if I have nerve pain? Why didn't amitriptyline help me? Why didn't the antidepressants help me? Because these are not actual, your doctors are lying to you. They're bullshitting us because they don't want to have to deal with the fact of the opioid crisis and the fact that they don't have answers and that they don't have good diagnostic tests and that they're not willing to work to find the root cause of your problem. And so they're pretending like these medications, these Band-Aid medications without a lot of good data that simply are like nervous system depressants, are actual treatments and solutions with data behind them, and they're not. I'm sorry.